Hello, today we'll be doing a classic cranial nerve exam. So I'm just going to start off by asking you a few questions. Okay, can I get started with your first and last name? Okay, what's your date of birth? Do you currently have any health concerns? Just a little bit of headache? Okay. Are you allergic to anything? And when's the last time you ate? And do you have 3 meals a day? And do you drink water every day? How many cups? Okay. Do you have any blurriness in your vision? Okay. Do you wear contacts or glasses? Okay. On a scale of 1 to 10, are you in any pain currently? And how many hours of sleep do you get a night? Are you on any medication currently? Perfect. Alright, so we're going to go ahead and get started. I'll be putting on my gloves. They are purple today. Do they look purple to you? Good. Okay, and just a few more cognitive questions. Are you able to tell me what color my eyes are? Yes. Okay. And what did you have for breakfast this morning? So I'm going to start off by listening to your heart and your lungs. I just want to get an accurate read on your current heartbeat and your lungs. Just want to make sure that there's no crackling going on, okay? So I'm just going to remove the shirt here a little bit. Is that okay? I'm just going to put this right here, okay? And breathe in. Breathe out. Breathe in. Breathe out. Very good. I'm just going to go on this side here, okay? Breathe in. Good. Breathe out. Breathe in. Breathe out. Good. And I am going to go behind you and check the lungs here, okay? So breathe in. Breathe out. Very good. So I don't hear any noises of crackling or your heart sounds strong, so that's really, really good. Then what I'm going to do now is check your temperature. So I'd like for you to just relax for me, just taking your temperature and the ear as well. Perfect. 98.5, which is good. No signs of fever. And I'd like for you to put your finger in here. We're going to check your oxygenation. Okay, just put your finger in here. Okay, oxygenation is intact. Perfect. I am now just going to focus really quick on your face. I just want to have a feel of your head. Let me know if you feel any pain at all. I'm just looking for any bumps or bruising or anything, or even an infestation. Okay, and your clavicles. Any pain in your clavicles? How about right here? Any pain here on your neck? And on the neck over here. Okay. Behind the head. Perfect. Okay. Alright, so now I'm going to have a feel of your face. Let me know if you feel any pain. Very good. Okay. Can you shrug your shoulders like this? Okay. Don't let me push them down. Very good. Okay, I want you to look at my nose. I'm going to try to move your head. Don't let me. Very good. And look at my nose. I'm going to try to do that one more time. Don't let me. Very good. Okay, I'm going to try to push your head down. Don't let me. Okay, I'm going to try to push it up. And very good, very good. Okay. Now, I want you to smile. Good. Okay. Any pain? Good. Frown. Any pain? All right. Lift your eyebrows. Don't let me push them down. Very good. Okay. So what I'm going to do next is take a look into your eyes. You said you don't wear any contacts or glasses, right? Okay. So I'm going to try to see if your pupils react to light. So I'm just going to have you just look right at my hand right here. I'm just going to check for dilation in your eyes. Okay, very good. We see dilation, and we're going to do this side here. Just looking for dilation. Perfect. Okay, now what I'm going to do is I'm actually going to take a look inside your eyes. Do you ever have any eye pain? Okay, perfect. So let me just take a really quick look. Okay, so it does look like your optic nerve is working. It's perfectly intact. The distribution is very good. Wow, you have really long eyelashes. They're beautiful, by the way. Okay, and can you look up for me? I'm just going to pull the eyelid down. I'm just going to pull the eyelid down. Just look like there is there's nothing wrong with your eyes. Very good. There's nothing wrong with the eye on this side, but let me go ahead and take a look at this side. Okay, so just look at my nose. Very good. I'm just going to take a look. I'm just going to take a quick look to see if there's anything there. The optic nerve is perfectly intact, which is very good, and it does look very healthy. Perfect. Okay, I'm going to pull your eyelid up a little bit. Okay, actually down. I'm going to pull your eyelid down. I want you to look up if you can. Okay, so just look up for me if you can. Just look up for me. And it does look like everything's perfectly intact. Very good. Now that there's nothing wrong with your eyes, we are going to do a really quick vision test here, and it is going to involve a lens. We're going to start off with the lens, and so I'm just going to put that onto the camera here. I just want you to relax if you could. We're just going to be putting on the lens here. Perfect. Thank you for waiting. I have a few cards. I'd like for you to tell me what shape you see on the card, okay? So what shape is that? Very good. And what is this? Very good. And what is this? Very good. Is this a monkey? Is he holding bananas? Good. What color were the bananas? Is this your favorite animal? Okay. Have you ever eaten these before? Very good. Is this your favorite color? Okay. And have you ever seen a yellow key before? Okay. And have you ever had milk before? Good. And what is this here? That cup. That's a cup. Yes. And what color was the cup? Perfect. So I do have a Snellen chart here now, and I'd like for you to look at the Snellen chart. Do you see the Snellen chart here? Very good. Can you tell me what letter this is right here? Good. And this? Very good. And this? Okay. And this? And this? Okay, I'm going to go a little bit faster now, so I want to see if you can keep up. Wow, you did a really good job. Is this circle bigger or smaller than this circle? Okay. And does this appear green to you? Does that appear red? All right. Let's do a color test anyways. So I've got a few Sharpies here. And what I'm going to do is I'm actually going to remove the lens, okay? Let's just take that off. Very good. Can you see my face? All right. We're going to do a few eye examination tests. The first is the wonderful Snellen chart without the lens. All right, so what letter is this? Good. What letter is this? Good. What letter is this? Good. And this? And this? And this? Perfect. Okay. Now I have a few cards here, and I want you to just tell me what you see on the card. Whatever the card says, that's what it is. I just want to make sure that you can see it, okay? Yes. Fish, yes. A monkey. Tree. Sun. A star. Milk. A yellow key. A black hat. And an egg. Do you eat eggs? Okay. I want you to look at this and tell me what color it is. And what color is the lettering. And what color is this right here. And is this the same color as this color here? Okay, perfect. Now I'm going to point to the monkey here. Okay, and I'm just going to have you look at this banana here. Okay, and just ignore what I'm doing. Keep looking at the banana. Just ignore what I'm doing. Good. Now, which letter is this? What letter is this? What letter is this? What letter is this? What letter is this? And what letter is that? Very good. You just spelled monkey. Good job. So I do have some more colors here I'd like to show you, and I just want you to tell me what color it is. Okay, let's get started. Good. Very good. Good. Perfect. Now, I do want to do this test one more time. I am going to show you some Sharpies really, really fast, and I want to see how fast you can keep up. All right. Good job. Now I have the same Sharpies here, or markers actually, and I'm going to point two in your face. Two are going to come into your vision, and I want you to tell me which color is closest to you, okay? All right, let's do that again. Good, let's do that again. And again. And again. Okay, got 2 more here. Let's do the same thing. Good. 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 Okay, I have 2 more here. I've got 2 more. I want you to tell me which one's at the furthest away from you. What color is the furthest away? Oh wow, you did a really good job keeping up there. That was wonderful. So now we are done with the eye exam. We are going to move on to the nose examination. I'm just going to have a feel of your nose. Okay, let me take a look into your nose. I just want to make sure you don't have a deviated septum or anything going on in there. So I'm going to have you look up for me, okay? Perfect. So I'm just going to look. Just making sure there's nothing inside. There's no deviated septum, nothing to be concerned with. And it also looks like nothing to be concerned with on this side either. It looks like everything is perfectly intact. Do you have any scabbing in your nose? I don't think you do. I'm not noticing anything, but you've never really had a nosebleed or anything like that, have you? Okay, let's put your head back down, okay? All right, we're going to do a few different tests. I would like to first off test your sensation on your nose, okay? And so I want you to just tell me if you feel this on your nose. Good, do you feel this on your nose? Okay, do you feel this on your nose? Good. We're going to do sharp or dull on your nose. I just want you to tell me which one is sharp or dull, and this is going to be on your nose, okay? Okay, good. 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 Good, okay. Now what I'm going to do is have you do a smell test, so I'd like for you to close your eyes because I'm going to put something near your nostrils so you can tell me what it smells like. All right? It is a scented glow stick. Yes, it is watermelon. Very good job there. I have another scented glow stick here. Oh, it smells seriously so good. Oh, I love this. Yes, we've got an apple pie scented glue stick. Very good. Let's do a few more tests. This is a tincture that I created. Okay, and I just want you to tell me what it smells like. Yes, that's right. Okay, I have another tincture here. Yes, that is correct. We do actually have one more here. Okay. Oh yes, it was rosemary. It was a little faint, right? Yes, it's not too strong. Okay, so what I'm going to do next is I'm going to focus in on your mouth. I just want to ask a little bit about like your tonsils. Have you ever had tonsillitis before? Okay, and do you brush your teeth regularly? Okay, I'd like for you to open your mouth, okay? I'm just going to take a really quick look. I'm just going to take a really quick look inside your mouth, okay? Alright. I'm just going to put your tongue, I'm just going to take your tongue and press it down. So I just want to take a look at your, yeah, so your teeth look really good. And no signs of infection or anything, no red tonsils or anything like that, which is really good. But we're going to actually do a really quick taste test, okay? And so I've got a few things I'd like for you to try, okay? And what does this taste like? Fries, yes. And they should be specifically McDonald's fries, yes? Okay, very good. And can you taste this? Okay, I'm just going to give you a piece at a time. Good. Okay, was that like pizza taste? Yes, okay. And I also have this here as well. I've got some sushi, so I just want you to tell me if this does taste like salmon. Okay, which it should taste like salmon. Perfect. And I do have a drink here as well. And what does that taste like? Soda. Yes, 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 yes. Okay, let's do some more taste testing here. Okay, and just go ahead and tell me what that tastes like. Yes, very good. And let's do that again. Go ahead and tell me what this tastes like. Yes, perfect. Okay. So the next thing is your ears. I want to take a quick look just to make sure that your ears aren't inflamed or anything like that. Look at the ear here. Okay. Does it hurt when I pull it up? How about back? How about down? Okay, let's go ahead and check this side here. I don't see a swollen ear or any infection arising. Doesn't look like there's any redness or anything. Does it hurt when I pull up? How about when I pull down? How about when I pull to the side? Gotcha. So I'm actually going to take a look inside the ear just to look for your tympanic membrane. I just want to make sure that it's the color it's supposed to be, which is pearl gray, and that there's like no excess earwax. And if there is, I might need to send you to someone who can clean your ears for you. Okay. So let me just take a really quick look inside this ear. I do see that the tympanic membrane is pearl gray. There's not too much earwax. There's no buildup of any kind that I might be worried about. So I don't think I need to point that out at all or send you over to anybody. But let me just double check this ear just to make sure that we're good. Usually both ears are like similar. So, okay, so let me just take a really quick look into this ear here. Okay. I see the tympanic membrane as well. There's no excess earwax. There's no scabbing of any kind, and no popped blood vessels. Very good. I am going to do a hearing test with you. So what I would like for you to do is, I'd like for you to close your eyes, and I want you to guess the sound, okay? And so the first sound is going to just be right here on the right side, okay? So on the right side, what sound is this? Okay, let's do that on the left side. What does that sound like to you? Perfect. Okay, let's do another guess the sound, okay? Water again, but it's a little bit of a different sound than before, right? Okay, let's guess the sound again. Good. Good. A spray bottle, yes. That is definitely the case. It was a spray bottle for sure. And I want you to guess one more time what the sound is, okay? And again. And again. And again. Good job! This handy dandy little thing makes the best sounds. Okay, I want you to guess again what you hear, okay? It is a trigger of some sort, and just tell me what it is, okay? And this is the same on the other side. Yes, very good. And one more sound. I don't think you're going to be able to guess this one though. Hard to guess, right? Like, how would you have guessed that? No worries, I don't blame you. But if you did guess it, like, that's incredible. That's crazy. All right, now I'm going to do a test that involves this handy dandy little thing right here. It's a tuning fork. Okay, so I want you to just close your eyes and tell me which ear you hear the sound, okay? So let's get started here. Very good, okay. So now, what I'm going to do is I'm going to create a sound, and I want you to just tell me how many times you hear the sound. It's going to be like a slight clicking sound, and I just want you to tell me how many times you hear it, okay? Good. 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 Now I'm going pretty fast, right? Okay, can you keep up though? Is it a little hard? Should I go a little slower? Okay. That was still fast. Okay, let me slow it down. Good. 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 Perfect. Good. Good. Okay, perfect. All right, so what's gonna happen now is what I'd like for you to do is tell me when you feel these sensations on your face. We're gonna be doing a really sort of lengthened sensational test on your face, which includes like the sharp or dull and such. So what I'm gonna do first is I'm just going to scrape your face just for a skin assessment for your profile. Okay, so I'm just gonna do some scraping. Prep your face for the sharp or dull test so you can feel getting all the dead skin off your face. Okay, perfect. Okay, let me just wipe the face. All right. So first off, we're going to start off with blue and white. Blue stands for big boop, and I don't know why I said boop. Big fluff. And the white one is little fluff, okay? So you can say big fluff, little fluff, white, blue, whatever you want. But I am going to touch your face with them, okay? So this is the big one. This is what the big one feels like. And this is what the little one feels like. And I'm going to do that again, okay? The little one feels like this. The big one feels like this. Okay? All right, let's do this. You have to close your eyes for this, though. You have to close your eyes. Let's get started. You're doing a wonderful job. You're doing a wonderful job. You got them all right so far. Very good job so far. You're doing amazing. Okay. Actually, you got everything right. I'm very impressed. All right, so I have this little device here, and I'm going to poke you with it. Lightly. It's going to be very gentle. And I just want you to say yes when you feel it. And you have to have your eyes closed. Let's get started. Okay. We're going to move on to you now telling me where you feel it, whether it's the tip of your nose, underneath your eyebrow, above the eyebrow, or on your chin. Okay? All right. Okay. Okay, you did a really good job. Again, you're really good at this. So what we're gonna do next is sharp or dull. And this is a pinwheel here. It's a little bit on the sharp side. I always want to make sure that I don't hurt you, but I do very gently. Okay, so you'll be able to tell if it's sharp and you'll be able to tell if it's dull, because the dull one is, it's just so soft, so soft. Okay, dull and sharp. We'll do one more test. Sharp and dull. Make sense? Okay, so close your eyes again. Let's get started. Remember, you're telling me if it's sharp or dull every time you feel it on your face. And you're telling me every time you feel it, if it's sharp or dull on your face. Wow, you did amazing there. You got most of them right. I'm really proud of you once again. Okay, so what we're gonna do next is I want you to tell me when I use my reflex camera on your face. I want you to tell me when you feel it, okay? Good. Very good, all right. So there's going to be a little bonus clip where I show you a bunch of different cards, and I want you to just tell me what they are. Once again, this is just the end of the cranial nerve exam. It is part of the eye examination, but like I said, it's a little bit of a bonus. Okay, so there's quite a few, and I'm going to show you them quite quickly. Some of them are cards I showed you earlier, but I just want to see how fast you can keep up. All right, let's get started. Some of these are shapes. Okay, so I'm just going to notate everything. You did a wonderful job today. You definitely passed your annual cranial nerve exam. There's no questions on my end. Cognitive questions were answered properly. Your eyes look great, your ears as well, and your sense of taste and sense of smell is divine. So I just wanted to say thank you for coming to my clinic today, and I hope that you have a wonderful sleep.